Direct cost. Costs that can be easily and conveniently traced to a unit of a product or other cost objects is called direct cost. For example, direct material, we can easily identify the direct material in each product. For example, if we are in a business of making chairs, then the wood is the direct material. And then the direct labor, it is the cost that we pay to the labor which is directly involved in the making of that product. For example, the carpenter who is actually making that product is called the direct labor. Then all the other costs which doesn't comes in the category of direct costs are called indirect cost. These are also called manufacturing overhead, like the utilities and the supervisor salaries and the depreciation of equipment. These kind of costs are called the indirect cost. Now let's see one example from the exercise. So this is exercise question number 1 from exercise. So in these questions, we have to identify the direct cost and indirect cost. These are the costs given, and then here you can see some of the cost objects. Let's read it out. Northwest Hospital is a full service hospital that provides everything from major surgery and emergency room care to outpatient clinics. For each cost incurred at Northwest Hospital, indicate whether it would most likely be a direct cost or an indirect cost of the specified cost object by placing an X in the appropriate column. For example, catered food served to the patients. So the food, we can easily identify the cost of the food to a particular patient. That's why it is a direct cost. Number 1, the wages of pediatric nurses. So the pediatric department, we can easily identify this cost relevant to the pediatric department. That's why it is a direct cost. If we change this question a little bit and change the cost object here to the pediatric patient, then it will be difficult to charge the cost of each nurse to each patient, how much we can charge the salary of a nurse to a particular patient. This will be a challenging task. That's why in that case it will be an indirect cost. But as the question is given over here, the wages of pediatric nurses, and the cost object is pediatric department, in this case it's a direct cost. Prescription drugs to a particular patient, of course it's a direct cost. Heating of the hospital to the periodic departments is indirect cost. The salary of the heads of the pediatrics, the pediatric departments, it's a direct cost. The salary of heads of pediatrics to a particular patient, indirect cost. Hospital chaplain salary, a particular patient, indirect cost. Lab test by outside contractor to a particular patient, it will be direct cost. And the final statement, lab test by the outside outside contractor, a particular department, it will also be a direct cost. So these last two will be the direct cost.